I was working at Clark Retirement Home, and it was about 9:30, and I went to take a break. And all of a sudden, I started to feel oozy, and then the sweat started pouring out of me, and then I started to talk, and I couldn't talk.
When the patient arrives, time is of the essence.
And there just happened to be a nurse in there, and she kind of knew what was happening to me. So she called an ambulance, and she happened to have an aspirin in her pocket. She put an aspirin in her pocket, in my mouth. And they called the ambulance. From when I went in the ambulance, I don't remember nothing until I got to the hospital.
They told me my husband was on the way to Metro Hospital, that there was something wrong, and that he was on the way in an ambulance, and could I get there?
And then they put me in intensive care, and the doctor talked to my wife and said that I had the worst stroke they could have. I had a blood clot on my left side of my brain, and it shattered. And if it didn't shatter, I probably would have been dead.
Stroke is the leading cause of serious long-term disability in the United States.
It was rough, let me tell you. They worked me 2 hours a day, every day. And they told me not to feel sorry for myself, that they'd get me back on my feet. And then, finally, after 2 months on rehab, and then finally they said, you can go home and go back to work. That was the best words I've ever heard.
My husband was in very critical condition for a short time, and it was very stressful, and all you can do is just keep thinking positive things.
Right now, I would like to talk to people that had a stroke and tell them my experience, and then tell them what they have to do to get back on their feet. You got to think positive, and a lot of prayers.
Reach out and help the more than 200 stroke patients at Metro each year.
I just think it's the greatest thing, I'm happy that everything, has turned out as well as it has, and due to Metro Rehab, I don't think he'd be where he was today. I think that's what pulled him through, and his positive attitude also.
I believe that Metro staff, they really reach out and help you, especially the nurses and doctors. Everybody at Metro was wonderful to me, and I'd highly recommend this hospital.
I didn't know Allie was as sick as she was. I knew she was very sick, obviously, because she wasn't eating, she wasn't having wet diapers and all that, and she just slept all day. I knew she was very sick, but I didn't realize that she was that sick.
Respiratory illnesses like pneumonia are the most common illnesses in children requiring hospitalization.
And then she just got really, really bad. She just was lethargic, laying around, not doing anything. She wouldn't nurse. I got mastitis. It was just not a fun picture.
I remember the day that Allie came in. She was only 10 months old. She came in with pneumonia, and she was obviously in a lot of distress when she came in. She wasn't comfortable at all. She'd been through a lot already in the ER just because they were trying to figure out what was wrong and everything that was happening.
And so he went in and he tried to find the vein, and he was having a hard time, and it broke my heart because Allie just would scream, and it's just like the type of scream that is so painful. So I said, okay, we just need to stop. Can we finish this? Since we knew we were staying, I asked if we could finish it upstairs.
So when she came up here to the unit, she needed an IV site, and it just wasn't going to be a very easy procedure for her. Again, we're coming at her with needles and that sort of thing, and that can be very frightening for a child that doesn't understand.
I think she went a little bit, like she had a little bit of discomfort, and then, the IV was in, and, she was more looking at the objects, and that was just, that was fantastic. Any mother would have loved that.
So the child life specialists really helped to make this experience much more positive for them, and really help them to understand what's happening to them, so that this isn't such a scary place and isn't such a scary thing. So really they can focus on getting better, and the families can too.
They just said it straightforward. We found bacteria in her blood. It's septic. We know the name of the bacteria because they let it grow. We're doing what we need to do. I was just really thankful she was in good hands.
You can reach out today to help us help our young patients here at Metro Health.
My experience at Metro has really wanted me to have my next baby here.
I've hated the word. I really have. The C word my whole life. Non-Hodgkin's lymphoma is cancer of the lymph nodes. Symptoms include fever, fatigue, swollen glands, weight loss, and night sweats, and it is treatable here at Metro.
Once it was diagnosed, it was almost a relief to know that, oh, that's it, and we can treat it, and let's get going on it, because it needs to be treated. Well, my family doctor, Paul Gauthier, is associated with Metro, and when I had symptoms of shortness of breath and fluid buildup in my legs, I went to him in early December, and we spent about 10 days, elapsed time in his office or here outpatient doing tests to try to determine the cause. So it was a natural to come to Metro. That's where he ordered the outpatient tests, and once we discovered it, it was a pretty quick call from the radiologist saying, get back here right away.
The disease not only affects the patient, but it affects the family and the friends of the patient. You know, the friends think, well, will we get cancer next because we're about the same age? And the family thinks, how much time do we have together? And, you know, Tom just really raved about the care he got at Metro. He mentioned different particular staffers and, you know, how they went the extra mile and, you know, they answered his questions, they solved his problems, and it really meant a lot to him.
Here at Metro Health, we see about 2 new cancer patients every day.
So I think to a person, the medical staff here is just wonderful. I'd recommend that to anyone. Surely the medical intervention here saved my life, no doubt about it.
The overall rates of survival for cancer are improving all the time, thanks in no small part to the willingness of people like you to reach out and help.
You know, now we have so much hope because of, you know, the really good outcome Tom had. It was just great to find out he was cancer-free. And, you know, thanks to people like you and the Metro Foundation, you know, he got the help he needed. And, you know, we just love it. You know, we love the idea of other people getting the same kind of help. It was a great experience at Metro for him.
Just that I'm very thankful. I'm grateful for the help that Metro Hospital has provided to me and my family through this you know, kind of important time in my medical life and in my life, for sure. Giving me a second chance, and I appreciate that.